Good morning, everybody, and a very welcome to this side event this morning at the World Health Assembly here in Berlin. It's my pleasure to welcome you all on behalf of myself and Professor Enyong Oy. Professor Enyong is the co-chair with myself at the Collective Action on Dengue. Enyong being professor at the Duke National University of Singapore Medical School and also at the Seoul School of Public Health. He can be with us this morning, but it's really a proud and wonderful moment to host this roundtable with you all. Thank you so much for making the time in what's been quite a busy few days, I have no doubt. Welcome as well to everyone online. I'm assuming we're joining from all sides of the world, so thank you also for being with us this morning. But I think importantly, it's been really lovely to carve out a little bit of time for dengue in this very busy few days of where lots of conversations and priorities across the whole ecosystem of health has been discussed and explored. And so I hope that over the next 90 minutes, we're going to have a lovely opportunity very much for a dialogue and bring our minds together to talk about not just the burden and the threat of dengue, but perhaps your own experience in your professional or personal activities, and also some of the solutions out there and how we can bridge any of the gaps in coordination, in collaboration, a long conversation, which I hope will continue far beyond these 90 minutes, but we hope this morning with the launch of the coalition, Collective Action Against Dengue initiative, that we can sow that seed. Before we really get stuck into it, I'd like to travel back to 2019, the WHO itself that year shares a list of the top 10 global health threats. And alongside quite formidable challenges such as climate change, antimicrobial resistance, non-communicable diseases, there is one singled out disease, which is dengue. And frankly, for a good cause. Dengue was and continues to be one of the few growing infectious diseases. It's in fact the fastest growing mosquito-borne disease on Earth. It's spread by a mosquito vector that has some very unique biological adaptations. And so looking at that picture quite globally, we know that dengue fever was in under 10 countries in the 70s. And unfortunately, 50 years later, we're seeing a huge number of outbreaks in completely new areas. The historically endemic areas are seeing much bigger outbreaks of increased magnitude, but also much longer across the dengue season. The mosquito is comfortably established in non-endemic regions. And so really, when you start to look at this picture, we're seeing dengue from 9 to 120 countries. We're also seeing conditions that are lining up perfectly for to cause a real cause for concern. And again, referring back to WHO, who mentioned that mosquito-borne diseases could in fact, will they be the next epidemic or pandemic even? So lots of questions there around this global expansion of dengue and the threat. And just to kind of really ground that into some figures without going too far back, if we look just at the year 2000, for example, officially reported cases were about 500,000. Jumped to 2022, that was a record year from 500,000 to 5 million cases worldwide. And that record only to be completely dwarfed within, again, a couple of years with 18 million cases in 2024. But of course, we know that is only the tip of a very complex iceberg. Real cases, the actual number of cases are estimated to be about 400 million. Thankfully, many of those might be asymptomatic or fairly mild, but the economic consequences and also the what is either alongside, instead of, or right behind dengue, which is other arboviruses, all of this is really presenting a raft of challenges and are equally problematic. Thankfully, at the same time, and I'll bring the doom and gloom to a close for the time being and reunite it even in this very room. Thankfully, we do have some excellent progress that's been made. First of all, in the awareness and the understanding of the disease, whether that be at a community, at a health policy, and at a scientific and research level. We have a lot of innovation across vector control, vaccines, therapeutics, and also there's incredible leadership at WHO, at member state level, and also throughout municipal, academic, research, implementation partners. So in truth, we do find ourselves at a really interesting inflection point. On the one hand, we have a real infectious disease dengue crisis. It's not being prioritized to the extent that it should, but on the other hand, we also have a lot of solutions and a real appetite for collaboration and coordination. And so that is where we would love to start our discussion today. How can we better illustrate and understand what the dengue threat really translates into in field? What are the solutions? What could help to marry the two and bridge the all-important coordination gaps? Where do we start? So those will be questions that we will hand over to yourselves throughout this 90 or 80 minutes. But first and foremost, I would love our conversations to be grounded in real experience in field. And so it's my pleasure to welcome, I will soon stop speaking and hand over to our wonderful speakers. We will share with you and hear from a host of regional, but also sectoral perspectives, and give a real flavor to what does this dengue outlook look like at this moment in time. So without any further delay, I'll hand over to our first speaker. It's a huge honor. Thank you so much, Your Excellency Francisco Quiroga Fernandez. You are ambassador for Mexico to Germany, and we'll hand over the floor to you and to hear about your experience of dengue in Mexico. Thank you and welcome.
Thank you. Thank you very much. Difficult to add what you already said. And indeed, in Mexico, we have witnessed how in the last few years, dengue and other tropical diseases have grown exponentially, and how they have been affecting the most vulnerable populations within our country, inside our country. There is a new sense of urgency to expand our capabilities, leverage on our capabilities by better coordination. And we know that we cannot let with the tropical diseases to happen what has happened with, for example, the corona virus, in which we pretty much lost the narrative with huge segments of the population, which now is reviving illnesses that we thought were totally in the past. Now they're coming back. Why? Because there's this narrative against vaccines and this sense that all this is created by the same people that is dedicating their lives and reputations and their work to mitigate these problems. So in Mexico, we have this new sense of urgency. We are building upon a strong culture of blood donations. We in Mexico, we have over 2 million blood donations every year. Some of it is used for the production of plasma and other blood products. Most of them get thrown away because of lack of processing capabilities. If just a fraction of these could be used to monitor, to research on tropical diseases, including dengue, then we will be in another situation completely. We are working on this. No one can do it. No country can do it alone. We are working with Germany and other countries to leverage and expand on our capabilities, monitoring and research capabilities in Mexico. We are engaging in public campaigns with civil society, NGOs, local authorities. These preventive measures like cover recipients, put them away, or even better, throw them away. We need to get people involved in this. We will not do it. This will not be a one-way solution from government to the population. It has to be work together. We need to win the narrative, and therefore we need to be convincing, and we need to be transparent. We need to make a better job communicating to the people exactly what is the situation and how are we gearing ourselves to address this. Let me make sure that I mention some of what my minister sent for this, otherwise I get in trouble. Our region has had a 200% surge compared to previous 5-year average. Mexico closed 24 with 125 confirmed cases and 550 plus probable dengue cases which is over twice 2023 figures. Technological innovation, and of course, we plan to leverage on all the technological innovation, recent technological innovation, including vaccines, streams, all these for an integrated management strategy within and in coordination, of course, with the Pan American Health Organization and the World Health Organization. So we have a national strategy for the control of dengue and other arboviruses, 2025-2030, which is aligned with our Mexico climate change strategy. And that's it. So thank you very much, and please consider Mexico as your trusted partner for this real challenge that we have to prevent the next pandemic.
Thank you so much. But this must be embedded in trust with the communities and very clear information, particularly around dengue. Thank you for that. We will stay for the time being in the region, and it's my pleasure to hand over to our next speaker, Ana Maria Cinnamon. You are the Tahoe representative in Panama, and so please, the floor is yours. We would like to hear your regional country perspective.
Thank you, Marian, and thank you, Ambassador, for your kind words about the collaboration with Tahoe. Thank you also to the network for allowing me to be here. As Marian was saying, my name is Ana. I'm the representative of Tahoe, which is the Pan American Health Organization, which is the branch of WHO in the Americas. But we are older than WHO. We were created in 1902, so it makes a difference.
Oh, sure.
Yeah, exactly. So I'm gonna tell you a little bit about the dengue in the Americas, and also what's the impact of climate change within that situation. I know I have a very brief time, so I've put some written notes here, because the information about dengue in the region is very rich, and dengue has evolved significantly over the past decades. And we started with a very successful eradication efforts in the mid-20s, 20th century, sorry. But the disease has been transitioning to a widespread hyperendemic transmission. And this shift is driven basically by rapid urbanization, climate change, and of course a weakened vector control system, which is creating the conditions that favor mosquito proliferation and disease spread. As PAHO, we have been playing a central role in what is dengue control across all the Americas, with a holistic and historic eradication campaign that drastically reduced transmission. But the resurgence occurred as urban growth continues and accelerates, and the control measures have weakened. And today we know that climate change and urbanization intersect and amplify what are the risks associated to dengue. And that increases also the survival of mosquito and the expansion of its geographical spread. So within PAHO, we have a regional strategy to address those challenges through its collaborative surveillance, risk-based control models, and also cross-border coordination to strengthen what is preparedness and response to dengue. Just a little bit of data regarding the dengue situation in the Americas, and as of 2025, we have reported 1.54 million suspected dengue cases, and a 68% decrease compared to 2024, but still 34% higher than the 5-year median in the region. It is the southern core that accounts for 89% of the cases, and the case fatality rate remains low, luckily at 0.05%. with more than 7,600 deaths averted since 2011. And these figures highlight both the progress and the persistent vulnerabilities. As PAHO Technical Cooperation, it focuses on three main pillars, which are surveillance, lab capacity, and clinical management. Surveillance efforts include what's the re-engineering of the integrated management strategy for arbovirus, and also implementing risk stratified control models to foster collaborative virtual spaces. In terms of lab, what the initiatives we have are to strengthen genomic surveillance, to monitor insecticide resistance through the network that it's called RELDA. And when we talk about clinical management, the advantages that we go through is through evidence-based guidelines using GRADE methodology, which is also a network of 13 countries. And we do also use what's the virtual campus for public health, which has reached more than 721,000 participants regarding clinical dengue management. And when we look ahead, what we see is the way forward requires strengthening climate-informed surveillance by integrating health and meteorological data for early warning systems. Of course, investment in diagnostic prevention and in clinical management are essential part, but alongside regional collaboration and cross-border data sharing. So these measures will ensure a more resilient health system, which is capable of addressing the evolving challenges which are associated to dengue, and not only dengue, but also other arboviral diseases.
With the climate agenda, and you've already brought in the urban dimension as well. So thank you very much for hearing both your calls for collaboration and ours here as well. We now turn to Singapore. Singapore, welcome, Professor Kinte. It's a pleasure to have you. You are Vice President of Global Health at the Swiss Holt School of Public Health. Singapore, fantastic example of challenges, but also huge successes in dengue control, from surveillance to operational, financial, but also importantly, political commitment. So we would love to hear from your experience. Thank you for being here.
Thanks very much for the invitation. And I will speak about Singapore, but I'll also speak a little bit more broader about Southeast Asia as well. I think for Southeast Asia, we clearly see a rise in the burden of dengue. And it's linked to all the trends that we talked about, rapid urbanization, as well as climate changes, rising temperature. But I think from a perspective of really trying to understand what are some of the policy actions that can be taken against dengue, that's where we started adopting an approach to try and really understand what is the likely size of the burden, and then to also link it up with the economic aspect of the problem and align it with the legislative approaches to tackle it. Finally, we try to understand what are some of the different policy strategies. So, for example, in trying to understand the size of the problem in Singapore and in Southeast Asia, this is where there is a rather geeky approach to use mathematical model to really try to forecast what is the burden of dengue, given the present rate of urbanization, the present state of infection that's seen in cities, not just in Singapore, but in different cities in Southeast Asia. But linked to really understanding that modeling, it's a very important element that we assume that helps to set priorities as well as it helps to understand the trade-offs. Because there are different policy options that can be used to tackle dengue. You could use the traditional environmental and vector control approaches, to which what has been shared earlier on about PAHO, understanding the rise of drug insecticide resistant vectors becomes very important. But the environmental and vector control is one approach that we need, again, a very regular process of feedback to understand, is it working or is it not working? There are other innovative strategies that have been adopted in Singapore, Malaysia, and Indonesia, which is through the use of genetically modified mosquitoes, Wolbachia. And even under that Wolbachia, there are different strategies that you approach. You can either use a suppression approach, which tends to be a lot more costly, and you need to perform that sex sorting of mosquitoes. You release the males, but you don't release the females. At the same time, there's another approach, which is through the replacement strategy. And each of these strategies are relevant, effective, or not effective, depending on the context. And clearly, there's an economic burden that comes with this, the use of Wolbachia for suppression or the use of Wolbachia for replacement. And then finally, even under the policy strategy, the policy envelope, there is the vaccines from different manufacturers, cicadas, Sanofi. But again, it comes with fundamentally some assumptions that requires a degree of understanding of what is spreading in the population, as well as the ability to very rapidly diagnose the circulating serotypes. So some of this decision-making therefore requires a very careful lens of regular monitoring and evaluation that I think Singapore will be very fortunate to have the resources, the human resource and the technology to be able to do that well. But I think what we have highlighted, what we have come to realize in a roundtable, a dengue roundtable that we hosted in Singapore for Southeast Asian clinical policy leaders, as well as also leaders from April and Zero, was that there is a very clear call to start thinking about the legislation against perhaps mosquito breeding, Notifiable Infectious Disease Act, which in Singapore, dengue is a notifiable infectious disease, which means within a period of 48 hours, physicians who identify a dengue case in the clinic or in the hospital must report back to the Ministry of Health, to which then information is circulated back to the agency that is in charge of addressing vector control. And sounds commonsensical, but in fact, it requires a lot of legislation to put in place, as well as enforcement to be relevant and to practical. Singapore is a very small country, and I think we have been fortunate that for such a small geographical country, we are able to do some of this legislative and enforcement approaches. But even when I mentioned the phrase, when we detect a dengue case, right now the question is the R&D ready for point of care rapid diagnostics that can be affordably rolled out in different clinics in different parts of the world? I think that it's one of the aspects that at least in Southeast Asia, the R&D efforts are focusing a lot on, really focusing on the rapid diagnostics, the point of care diagnostics, not just on the therapeutics. Some of the R&D have also identified that it's not just a matter of the serotyping that is important, but even serotype-specific genotypes may now have an impact on the risk of severity or complications of the dengue infection. So really trying to understand some of this genetic epidemiology of the dengue virus, it's part of the R&D process that's happening, at least from our perspective, in Southeast Asia. So those are just some of the immediate feedback that I thought I would just share in addition to what has already been shared from Pablo and Mexico. But very happy to discuss further later on specific topics. Thank you.
Thank you. Updating perhaps also that size of burden and economic impact. So thank you, I'm sure we will come back to that. I'll hand over now and welcome you, Jean-Marc. Thank you, Maria. Sure. I will hand over to you to bring it all together as you do so well.
Sorry, I'm late. Please.
No. It's a pleasure to have you. Thank you, Maria. Jean-Marie Bacobello, welcome. Thank you. You are currently a strategic senior advisor to the executive director at Africa CDC, You bring your wealth of experience as former WHO director of immunology and vaccines. And so we'd be very interested to hear your perspective of what does dengue look like across the African continent? What does the surveillance and the research, and what are some of the challenges that might be regionally specific? Thank you.
Thank you, Mariam, and thanks for having me here. I think it's we are talking about dengue, an emerging infectious disease in Africa. Is where already have crowded infectious diseases emerging and re-emerging, and clearly we are finding that there are gaps in surveillance. There are gaps in understanding the transmission intensities. I was recently chairing a meeting where we were discussing, the causes of fever of unknown origin, and it was important to notice that for some of the studies that were shown, although in the recent, until this recent past, anything that would be coming to the hospital as a fever would be equated to malaria. It's being shown now that with a number of interventions to control malaria, the proportion of non-malaria febrile illnesses is increasing. So the issue now is for what is there, how much of this is dengue? How to know this? You need lab, right? You need to confirm this, and that's where the issue is. So we have gaps in terms of accessing lab facilities and having these across many countries. But there are great experiences from Institut Pasteur Dakar since now more than 10 years. They have the so-called end-to-end surveillance of dengue and other arboviruses. They're looking at any case of febrile illness in some sentinel sites, looking at what could be the causes, including searching for dengue cases, and they've been successful doing that not only in Senegal, where they've shown that the disease is spread actually across all regions, but also increasing as years goes by. But they have now started to expand the surveillance in other countries, neighboring countries, Burkina Faso, Cape Verde, and so on. Some of those countries that have outbreak actually identified of dengue in recent years. So expanding surveillance in other sub-regions, Eastern Africa, Southern Africa, Central Africa is essential so that we get a much better picture of the disease burden. Now, whether we need necessarily good disease burden data from each country to, for instance, start some of the interventions, that's a good discussion that needs to be done, because we know that through experiences, we have had, for instance, vaccines used in countries where without necessarily generating local data. I go to the extreme at the hip vaccine, but that was easy because it's a combination vaccine, but there was no local data for take HPV, but that's also too easy because we know that the disease is there. But the point I'm trying to make here is that we do not need, a very strong surveillance system in each country, but at least have sites, countries where we can have, decent data, including serotype distribution, genotype information, so that we are clear about how one can use the vaccines, and we know the issues with the vaccines that we have. The other aspect that I would touch upon is on the the financing of any policies that will be put in place. If I again refer to vaccines, we know that they are pretty expensive, and it's more than $50 or so a dose, and then you need 2 or 3 doses to have a decent protection. That means that there will be needs to identify, financing mechanisms. Given the competition out there, we have, as I said, so many other vaccines that are needed in countries, and they are quite costly for some of the countries that are especially being supported by Gavi. But we know also that there are self-procuring countries, including in Africa, where affordability then would be an essential factor, before engaging in any one of the possible pathway for using the vaccine. The other complex things talking about vaccine is the delivery system. Here we're talking about vaccine to be given from 9 months, 9 years. Well, if we look at the example of HPV, reaching great coverage with HPV vaccine using the platform of adolescent health is not that easy. And then you have to space the vaccine every 6 months, and so there are some operational issues there that one needs to work on. But in any case, these are not strong barriers, because we've seen in these countries embarking on HPV vaccination. We've seen countries in Africa doing malaria vaccination with 4 doses, including the last dose given 1 year after the 3rd dose. So there are ways of addressing some of those bottlenecks, some of those challenges. It's not impossible, but it does require that you have resources to train, to supervise, to follow up. You have resources to do the integration, an integrated approach, so that it's not just about one intervention, that you also do good vector control, you do community mobilization, and so on. My last point here to say, when I think we could learn from what has happened so far, as we have experiences in tackling complex situations, complex conditions, diseases, emergencies, and then by bringing, our collective experiences, we can find appropriate ways of addressing policies, addressing financing, addressing, mobilization of communities, so that and the leadership, so that we can tackle dengue, because at the end of the day, it's about preparedness, right? So we have to, we can do that. Again, as was done for polio, global solidarity, for malaria vaccine, bringing regional coordination, and bringing resources from different sources, so that we can address some of these complex issues. Thank you.
Surveillance, whether from Cameroon to Ethiopia, where a malaria mosquito is now behaving like a dengue mosquito. So be a great partner to keep updated on this fast-moving dengue and arbovirus situation worldwide. Thank you, Jean-Marie. And now I turn to Maria Van Kerkhove, here representing the WHO. You're Director of WHO's Epidemic and Pandemic Management Program in the Health Emergencies Preparedness and Response Department. So you are well versed in outbreaks and crises. We all remember you as team lead during the COVID pandemic. So thank you so much for being here this morning. We heard the regional perspectives. It's a pleasure to hand over to you WHO is doing amazing work, bringing all these resources and partners together and creating a wealth of tools really that can be used to track these different problems. So Maria, thank you and welcome.
Thanks very much, and hi everyone, and it's really lovely to see you. I'm sorry I was late. It's one of these days where we're double, triple booked. I don't know if you guys feel it, but it feels like speed dating this year. Not that I've ever done that. But no, thank you very much for the invitation to be here. And so I have some remarks which I'm going to read, but may add to that in addition, because I work with amazing people all across the organization. You get to see my face, and thank you for not saying the face of it. I appreciate not having that as part of the introduction. But I think we all know, following the Zika emergency of 2016 and the growing concerns that we see of dengue, of maracuja, of chikungunya, we need a coordinated approach towards dealing with arboviruses. And that effort was evident then, it's evident now. So teams across WHO, working with many of you and many partners around the world, have come together. And in 2022, we launched the Global Arbovirus Initiative, recognizing, it's obvious to all of you, but recognizing that these are the same individuals and countries who are dealing with many of these pathogens and trying to be much more conscious of resources, of time, and of effectiveness and how we could deal with these in an integrated way. And since the launch of this initiative in 2022, we've been better able to respond and support regions that are really grappling with record-breaking numbers that we've seen. We had a grade 3, which is the highest level of operational response that WHO uses as part of our emergency response framework to deal with dengue from 2023 through November 2024, with at least 14 million cases of dengue reported during that time period. 2025, in this year, we've seen a resurgence of chikungunya in the Indian Ocean, large outbreaks in central countries in Asia. We've had dozens of clusters of chikungunya spreading in mainland Europe. That's never seen that before. And that's just going to continue. We keep mentioning climate change. We keep this as not a theoretical risk. We are actually seeing the mosquito vectors moving further north, further south. We are seeing countries that have never reported these cases before reporting cases, which is really demonstrating the risk. We estimated 4 billion people were at risk from chikungunya, Zika, yellow fever, dengue, and that's growing to 5 billion in the next couple of decades. So this is a risk for countries, many countries around the world every single day, with at risk and seeing actual cases. We do also, at the same time, there was a large amount of yellow fever that was circulating in the Americas than had been in previous years, with expansion in geographic scope. Largely, these have been brought under control. We see continued outbreaks of yellow fever across the African region with thematic spillover and urban introduction. And we're navigating this with vaccination. And luckily, we have a really good vaccine in yellow fever. Very, very lucky with this. But taking into account all this recent epidemiology, historical trends, the new trends that we're seeing now, there's a lot of pressing questions around transmission, a lot of disease risk, expected patterns in endemic areas versus areas where dengue and other arboviruses are introduced, and how best to handle this, how best to equip countries with prevention, surveillance, with response, with community engagement. And I fully agree. Outbreaks begin and end in communities, but they can also be prevented by communities. I think we need to start changing that phrase. It's not begin and end in communities only. They can be prevented in communities if communities have the right information, if they have the right tools, if they have the right resources. So there's a lot of work that needs to be done. So we're about 4 years into the Global Arbovirus Initiative. We're about a year and a half away from the I strategy ending its cycle in 2026. And so we're looking at the Global Arbovirus Initiative 2.0. And what does it actually mean as we are continuing to support governments and learning from the first 4 years. So we're mapping this out for the next round for 2026 through 2030. And we really also want to celebrate the successes, things that are working well, because a lot of things are working well thanks to all of you, and bringing that in to put the advances of what's happening into this next stage. We did also recently finish these risk maps of spillover and amplification. We have a dashboard, which we're going to work with many of you on this, building on dashboards that already exist. for 18 pathogens with epidemic and pandemic potential, including several arboviruses. And in the dashboard that you'll see, you can group them by respiratory pathogens or arboviruses and whatnot. And taking into consideration the environmental suitability of these pathogens. And it's really an advocacy piece to work with governments to say, you know, you are concerned about these number ones, but what about the following? What about, and it's actually shown true where we've seen some recent Marburg outbreaks, you know, Ebola outbreaks where they haven't been detected. But it's also to encourage stronger surveillance, making sure that the clinical care pathways consider these types of differential diagnoses and make sure that we give patients the care that they need. And also inform risk communication and community engagement ahead of an outbreak, not just during it, right? So we will make that available to you soon. But 2025, I'm sure you guys have all comments on this, has been a pretty incredible and difficult year on top of many years of difficult years. And we're all forgetting COVID happened with this collective amnesia, but it's pretty telling, you know, in the trauma that we've been through, but that needs to propel us to do more. Many organizations are going through change, are going through restructuring, are going through changes in finances. WHO is no different. We have incredible, dedicated people that are there. We are losing incredible, dedicated people. We've tried to do this in the most humane way as we can because, frankly, there's a lot out there that's quite cruel and shocking and brutal and unnecessary. But nonetheless, we've had to have some pretty deep reflection of what's going on with us and what we can deliver on. But epidemic and pandemic prevention and control and management is core to what we do. So I'll finish by just saying, like, there's principles that we operate under, which are true for dengue, are true for arboviruses, and we are looking at being very clear on our mission, on our objectives, on our priority actions, and what WHO needs to do as WHO, and what our partners need to do. We don't need to do everything. We don't want to do everything. And we don't do anything alone. So we rely on what you all do and how you all contribute to this collective action. We want to capitalize and leverage technical and strategic partnerships to actually deliver to the people that we serve, to have the most impact that we can with the least amount of resources, to have the intended consequences, not the unintended consequences. We as an organization, sort of our bread and butter is to provide clear evidence-based, science-based recommendations and countermeasures, and to evaluate them as they're rolled out, and then to make changes as necessary. Make sure that they are modified, implemented, and adapted at regional and at local levels. We want to continue to learn from all of you in centers of excellence and your success stories with dengue prevention, management, that's shown to be working and actually having an impact, and encourage the transfer of skills between all of you, between member states. We want to reinforce the support for communities who are at the center of all of this. We want to make sure that we have local and national leadership in this. This is where we really see this take life, with political commitment, with sustainable financing, which is a hard ask right now, but building on gains that have been made over many, many years. And we really feel like these collective efforts, us actually all working together locally, regionally, globally, are strengthening surveillance. They're strengthening preparedness and response. And you will help us to ensure initiatives like the Global Arbovirus Initiative will have the meaningful impact that we all want. And if you had feedback on this, we welcome that feedback. We welcome constructive criticism of what we do. We are a changing learning organization, and all the time we need to be kicking the tires if you will. But it's a real pleasure to be here today at this launch of the collection action on dengue. It embodies all of the principles that we feel are important. And you are really, all of you are valuable partners to WHO in the fight against dengue, but other arboviruses. So thanks very, very much for the opportunity.
The tools and lots of things that we can kind of get together and come together without this very complicated disease. So thank you for that. So we've heard a really lovely variety of regional perspectives, some salient themes and points come up quite a few times. I've tried to pick out some of the main ones, but I hope that in about a minute or so, you will be able to add to this, share your own experience. But so what we've heard is in no particular order, but surveillance. So really improving surveillance to understand better, but also in real time, what and where arboviruses, dengue particularly, what's happening year to year. The numbers are so different now, and the serotypes will no doubt give us a lot of surprises, and that goes. Sorry. Modeling outbreaks to clinical management to active and real-time surveillance. So really bringing that together. And also that relies very much on data to better understand size of burden, but also economic burden, investment case, bringing those communities, as Maria just said, really focusing on the public engagement, but also empowering communities. Professor Yukini mentioned legislation. We don't talk about that very much. How and where and do we make these dengue a notifiable disease? How do we influence and help communities to act in their own backyards? And then, of course, we heard about the built environment, urban health dimension with more than 60% of the cities of 2050 having not even been thought of. And finally, the climate sensitivity and all that being brought together under this umbrella of the really pressing need for partnerships and collaborations. And so at this point, bringing all this together, it's my pleasure to hand over to you, Lourdes, because as Vice President of Global Health and International Relations at Fiocruz, which is excellent at all of these points, including the international collaborations, including translating research and technology into an operational public health program. So we would love to hear your regional perspective, but also as a academic tech transfer partner in this space, how are you seeing the dengue burden at the moment, the challenges, but also the future?
So good morning to everyone. I would like to first thank for the opportunity to share our experience with you, and I was listening to many points which were discussed here. And in fact, even because of our epidemiological synergy, Fiocruz, of course, have developed lots of experience on that and developments too. And so bridging science into public health policies and also dengue-related actions, not only dengue, but viral, because that's the way Brazil really deals with like syndromic group of diseases. And so I'll speak a little bit about Fiocruz, of course, same as for, otherwise my president's really my blood, but also it's very important to give you an overview because Fiocruz is really a huge institution. So Fiocruz Scientific Public Foundation under the Ministry of Health, but we have lots of connections with many other ministries in Brazil. There's a significant historical role in public health and science, technology, and innovation. The foundation hosts a complex R&D ecosystem, and this is our treasure and our lucky, spanning multidisciplinary-based research to the production of medical products like vaccines, IVDs, and also therapeutics beyond social technologies and so on. So there's a huge portfolio of innovation in Fiocruz that primarily target, of course, our Brazilian public health challenges to support our unified health system. And so tackling epidemics is in our institutional DNA, and along with this 125 years of experience, has enabled Fiocruz to host WHO cities and 70% of national reference laboratories for notifiable diseases, including arboviral. So we are dealing with virology, entomology, resistance to insecticides. So it's very rich to have all these groups, the experts, all together. Give support to the mental health policies for sure. And so, besides research and innovation, these labs assume a frontline response to sanitary, epidemiological, entomological, environmental surveillance, genomic as well, diagnostic, regulation, and national international capacity building. In addition, epidemic responses are also supported by our 2 reference hospitals, and it's extremely important in case of epidemics, all these expertise, because one of the greatest challenges is clinical management and how to really reduce mortality, and it's as simpler than it can be, but a longer epidemics, especially of higher magnitudes, it's really a problem despite all the experience we had accumulated along years. And also we have the diagnostic throughputs that we developed to build up a longer COVID-19 pandemic. It's extremely important when you really scale epidemics, because then the laboratories are not able to really attend the huge amount of samples. And so it's quite rich, and we have been using pneumococcs and other epidemics as well. And so to address the crucial aspect of surveillance and diagnostic, Fiocruz developed rapid tests, as you are mentioning, that effectively identify dengue virus and serotypes. That's very important because we have a stipulation of all dengue serotypes, despite they're changing a long time, their distribution, and other related arboviruses. The advancements are vital cases of overlapping arboviral infections, where co-infections with Zika, chikungunya, urupushi, and so on complicate the clinical presentations. Fiocruz also engages in information and communication through various observatories, including one on climate and health, that's based in Bahia, in northeast of Brazil, and they utilize big data from national databases, and not only they're able to follow up, but also to evaluate public policies, economic burden, and so on. It's fantastic. Our teams have developed monitoring system using real-time data analytics for early warning and tracking epidemiological trends and outbreaks, such ISO. Powered by AI and machine learning, it uses digital data from various sources. So health database, genomic, environmental, social media message, drug sales, all databases in Brazil. It's just merging and really analyzed all together. It's also a fantastic platform. And we are working together on that with the WHO Center for Epidemics and Pandemics Intelligence. ISOC serves as a component of regional global platform for pathogen surveillance and response, integrating ecosystems for preventable diseases, possible diseases, epidemics, and pandemics. In fact, it's already part of the Ministry of Health policy. We started locally, and then we are improving to really reach the federal surveillance. Lastly, community engagement is a cornerstone of Fiocruz approach, recognizing the vital role of the local population plays in controlling disease transmission. The foundation actively engaged communities in preventive strategies by educational campaigns. And so, as much as we can, we really are working with our communities. It's extremely important. It's something. It's even a value, institutional value for us. Educational campaigns increase awareness about dengue risks, not only dengue, but other viruses, and encourage residents to participate in vector control initiatives. And so this is a policy, long-term policy from the Ministry of Health. TV, radio, whatever, it's informing everybody how to prevent, how to do, and asking people to help us, to really integrate them as part of our preventive policies. This extensive capacity led to our invitation by the WHO R&D Blueprint for Epidemics to coordinate the collaborative open research consortium for flaviviruses. And so we are talking on the same thing, and it's a great opportunity to really work together. Because this initiative that reflects perspective from the North and the global South aims to facilitate exactly inclusive perspective, collaborate R&D to bridge knowledge gaps and expedite MCs, because we can have wonderful research, but if we don't have products and products accessible for everybody, will not tackle epidemics or pandemics. And so it's extremely important and even to work all together to listen all specificities, the regional gaps and so on, and to work all together on that. And so WHO, congratulations. It's a fantastic initiative and it's a pride for us to be part of. One expected outcome is the creation of an R&D roadmap, so we can really work together on that. That must be improved. It's quite dynamic and must be improved a long time. Moreover, we are closely collaborate with the WHO Center for Pandemic and Epidemic Intelligence with different initiatives that I will remark mostly. Besides ISOP, another digital platform we have developed. And the idea is really to leverage these systems, these platforms to be available for other countries. Yes, and how to really implement, because you have different technical database structures, technical things, and really to try to apply, to leverage that for issues too. And so to the remarkable advances in real world application for public health, I would like exactly to use the digital platforms as an example of translating science, technology, and innovation into public health action and decision making. So we have a platform that's called InfoDengue. It's available online. That's a monitoring system for arbovirus disease. The platform utilizes epidemiological and meteorological data to generate alerts that aid health authorities in forecasting and combating mosquito-borne diseases. So it's for dengue, but also for chikungunya and Zika mostly. And this platform features continuing monitoring of dengue, Zika, and chikungunya incidents across all Brazilian municipalities, data integration, merging epidemiological data with climate information to identify risk patterns, produces early alerts for government and health organizations to act in controlling these diseases, so it's decision-making processes, analysis and forecasts. In fact, it's now casting that's doing, because it's dynamic analysis using statistical models, of course, with trends and transmission peaks, and provides analysis and data for public health authorities to make informed decisions. And so this is, I'm a fan. Yes, I'm totally a fan of this group. They are really fantastic. In 2024 epidemic, that was the hugest Brazil had also faced, the lowest mortality rate was really detected in Rio de Janeiro. Yes, we have lots of problems, especially political, and we export terrible politicians. But our health secretariat and coordinator of epidemics, it's something really fantastic, because the health secretary is modeling everything and following up even the clinical attendance. So how many times the patient is coming back to the same services and so on, in order that they were really able to reduce. It was the lowest in Brazil. And this model is being somehow exported to other Brazilian municipalities. And the InfoDengue was exactly one of the strategies that were used to follow up trends and localize and go directly in place the hotspots to make public health intervention. And so besides that, this is a local policy, a local action, but I have to say that exactly that. You must have political thinking, otherwise you can have all tools and nothing will happen. And exactly due to this huge epidemic, the Ministry of Health made a 24-25 plan, including many different actions. Yes, exactly involving prevention, control, and so on, supported lots of funding of that. And so it's absolutely fantastic in a sense. And so besides field tools, just a little bit and very fast, because of course I have exploded my time as labor, but not only we have the WHOCC in Brazil, in Pará, in Chagas, we have been, the Brazilian government had purchased almost, I think, all Takeda stock, because Brazil is a continent, we hold on the part of the population. But because of that, there was an agreement between Takeda and Instituto Butantan, who is also public production that producer in São Paulo, to really produce to all our unified health system, because we make vaccines really available for all Brazilian populations. And lastly, I would like to say about the VOBAC strategy. It was extremely successful in some cities in Brazil. And so in Fiocruz, we launched 2 factories. One in the south that was already launched. And I think, if I'm not wrong, it was the biggest production from Volvitos worldwide. And another one in Ceará that's in the northeast, also with a huge production. So the idea is really, we have a plan a long time, of course, but we already started by Ministry of Health to really use that in many different municipalities because the prior results were fantastic. And in the end, it's costless. Yes, this is an argument that I think must be used. Cost benefit. It's too much more to invest in prevention and really to have the burden analysis and so on to prove on data than to keep on treating and seeing people losing because they're not able to have protection. Yes, so thank you very much. We keep on discussing a lot.
Many academic centers around the world was already putting into place all these strategies and tackling the main challenges around dengue. So we have much to learn from you. And a lot of what the collective action on dengue initiative has been doing over the last year is really this listening exercise. And there's been a building conversation, a building movement. So now about 40 organizations have come together around these main gaps and challenges and really trying to, at the same time, drive an action agenda, but also very much listening to what everyone needs. So 40 organizations, Pastor Network, Canberra Collective as secretariat, and 3 working groups at the moment around urbanization, innovation, and financing. So 3 themes that we would love everybody to get involved in, to join. Really, the words are in the name, collective action. And so at this point, sort of building on what we've heard from our speakers, it's more than time to open up to the floor. If anybody else would like to share some of the challenges that you're facing or that you feel is really prioritized around dengue, please don't hesitate to take the floor. I see movement, but I don't know if that's hands up or.
I guess I can start.
Yes, please.
So hi everyone, I'm Sarah. I'm a doctoral student at Oxford and I work for the UK Hospitality Agency. I'm originally Singaporean. I undertook a very big dengue research during my master's, which was to identify why dengue was still endemic in all 11 Southeast Asian countries. One of the feedback that I got, especially from Cambodia and Laos when I spoke to them, was the lack of facilities and staff to confirm dengue cases, especially when you're in the febrile stage. You're not able to distinguish between other mosquito-borne diseases. They also spoke to me because they know I'm from Singapore. They actually needed some assistance and help in terms of pioneering Wolbachia strategy because Singapore obviously has a lot of success in that area. So that was the biggest gap they found in terms of the lack of research sharing. They needed more assistance, especially from countries that have already established such a strategy. So especially from countries like Cambodia, Laos, Thailand, they come from urban and rural areas. So you need to undertake different strategies for these 2 kind of environments. So one of my research was discovering that the integrated vector management was a very good strategy involving biological aspects, for example, using guppies to kind of stop and prevent it from actually becoming into the adult mosquitoes, for example. So that was one of the feedback that I got from these other Southeast Asian countries. Timor-Leste was also one country that didn't produce a lot of research and studies. So I think just understanding about how we can actually share
and disseminate information, especially from countries that have more success, like Singapore and Malaysia. Yeah, thank you.
Thank you. That's a really excellent point, and definitely something that at CAD we would like to focus on is have open policy dialogues and knowledge exchange, and also really amplifying all these amazing resources that we are already in existence that we can learn and share from each other. Some countries are excellent at sort of embedding colleagues in other nations' health systems and building capacity in that way. So thank you. That was a really important.
I guess as soon as everyone's really shy, I'll just jump in and start some conversations. I guess, again, thanks so much for everyone to turn up. I should say I'm Kevin Tester. I'm Director of Malaria and Fever and Climate and Health at FIND. Really great to see so many people coming in. And I guess one of the things really useful to understand is you're all doing some amazing stuff in this area. And I just wonder whether there are key critical gaps that you see that are sort of, if you like, low-hanging fruit, things that other organizations like ours and others can step in and help you fill. You know, we're a nascent, we're a new organization. We're not really coming in to say we know it all. We do not. But what we do is work with you. And so, you know, the stuff that WHO is doing is just fantastic. I mean, everyone's talking about all this stuff. It's just blowing my mind. And I just kind of wonder, where do you feel that there's a critical gap that an organization like ours could fit in? And where do you feel that point of collaboration can fit? I'm just kicking it out there as a sort of spark point to get everyone talking. Yes, please.
Maybe I could start you from find. You said yes?
Yes.
I mean, I think on the diagnostic, there's so much attention these days on vaccines for everything.
Yeah.
As the solution for everything. And of course, vaccines are amazing, but they're nowhere near one size fits all or one solution. And I think on the diagnostic side, I mean, there's a lot of work that needs to be done. Whether it's rapid diagnostics, whether it's point of care, but it's testing for something, testing getting into the clinical care pathway, testing for surveillance, testing for something. And there's the ability to have effective, accurate, affordable, accessible diagnostics is what we really need. So organizations like yours can really help with that. You can also help in the assessment of the diagnostics that are out there. There's a lot of snake oil in diagnostics. You know, we saw during COVID, but it's going to happen again, right? When we need diagnostics, production will increase and everybody will produce, but and governments will purchase because it's showing that they're doing something. They can't buy the vaccine yet, or they can't get something else. So they'll buy serologic tests. Maybe that's not the most appropriate test or whatever. We will need help. And this is in dengue, but it's across the board on the evaluation of these diagnostics. So I do see that as a gap across the board for pathogens with epidemic and pandemic potential for the known ones, but and certainly for the new ones. But that's an area where we need to put more attention, more financing, more resources in R&D. But in the evaluation, I think for me is a critical gap.
I agree. Please.
Yes, I would say the same thing. The first thing is about 20% of the infected cases are positive. What's going on with about 80% of cases? I think this is a real question to be answered. Yes, and in different scenarios, in different regions with the specific. Second thing is exactly this. Brazil had launched the G20 presidency, the global coalition for local regional capacity. To enhance that. This is extremely important because first, the question of access. Yes, second, it's a permanent policy, but it depends on political commitment and investment from each government. And so the technological transfer, for example, from an institution like public institution like Fiocruz. It's totally feasible. Yes, but then you have to have the capacity to really have. And so the first thing is which tests, which targets, which antigens, what's going wrong that in general you have so low positivity. The second part is I resolve that, or at least the optimum. We have some let's say something like that. The optimum is the enemy of the best.
Yes.
It's better to have something than to have nothing.
Yeah.
So while we don't solve, we need to have access to such kind of tests. They're not perfect, how to be, but that's what we do have as tool. But in the other hand, it's very important that the regions, I don't know, tell that every country should have that, but at least, for example, in Africa, which countries could be performing that, and in every region, to really at least have a factory, because a vaccine production is something, it's quite expensive and quite challenging, but for diagnostic tests, much more easier.
Yeah.
So should be, I think, a step to be worked. And in this sense, I didn't speak in my speech, but the patent is a perfect on, in Americas. That's absolutely fantastic. And even in the Americas, led by PAHO, we are just mapping the local capacity. So it's extremely important we reinforce our response to it.
No, thanks both. That's really useful. Anyone else?
And I'm happy to jump in. So I'm Maya, I work with the IFRC. And so you probably know that we're quite active in responding to outbreaks, but we're also more and more trying to invest in prevention and preparedness. So there are a few activities that we're doing on dengue, which I can mention. I mean, we focus very much on risk communication. There's a new partnership that was signed in Asia Pacific with Takeda that focuses very much on risk communication for dengue. We've also been focusing on early detection and early action through community-based surveillance. So trying to extend the reach of regular surveillance systems through volunteers, for example. And recently we've also engaged in early action protocols. So trying to see what we can do to immediately release funding when there's a case or there's an outbreak that's suspected. So the first protocol was approved in Sri Lanka. And then talking about knowledge sharing, so already within the Red Crescent movements, we're already sharing this knowledge between the different regions. Because the Americas, for example, is extremely keen to learn from this experience in Sri Lanka. So just a word for you to also know that Red Crescent national societies are interested to engage in this topic. And, feel free to also approach them if they haven't approached me yet. And then we're very keen to engage in partnerships because nobody can do it all. I mean, Maria was just mentioning testing, which is something, Red Cross can't do. And that's a big challenge when we detect cases potentially early. And then there's nobody to test. And so, the early warning system doesn't function in that sense. So it's, for us, it's crucial to have these alliances and also learn from you all. So I'm very happy to join this group today and learn from you. Thank you.
Good morning. My name is Curtis Germany and I lead global vaccine policy for MSD. And first I want to thank the collective action for bringing us together. I certainly learned a lot from the speakers there. At MSD, we're building on our long history in developing interventions to prevent and treat infectious diseases. We are advancing research on a dengue vaccine. But of course, we all know that bringing these innovations are not really the solution, by themselves. It has been covered here by many of the speakers, they're part of integrated strategies. One point that really caught my attention to the speakers was the discussion around political will, legislation. We know that to bring innovations and advance with what is needed in these very complex spaces, you need that to reach populations at risk. So I'm just interested, just from some of you that have been directly involved in working with policymakers, whether it's legislation and getting support I have done that in such a crowded space because we know that, whether it's parliamentarians, ministers of health, they're dealing with many different types of priorities. We know that this is a big issue, but there are many others. How you've been able to do that? Maybe it's a learning for many us sitting here in the room today.
Thank you for highlighting that. I think I'd like to mix a few of the topics that were raised. I mean, definitely in terms of vector-borne disease control, we have different strategies, and it's not only the vaccine, which is the silver bullet. And these strategies need to be customized to each of the country settings. But I think the work that we do on research, on innovation, and creating, for example, new RDTs, more efficient, quicker to use, quicker to move, to deploy, etc., is essential. But I think we need to also take into account the legislation and the context of each of the countries. In my position, I see all these initiatives that go from the research side that tend to be kind of, I don't know whether blocked or do not end up being implemented because we don't have the right legislation in the countries to implement those technologies. I can tell you, for example, RDTs. There are countries where people who are not in one specific area are not allowed to use RDTs. So how are you going to be doing diagnostic of, let's say, HIV, or syphilis, or some other disease? Dengue, in that case. If the legislation of the country is not allowing people who are not in the healthcare system, and specifically from one type of health area, to use that. So I think it's essential to work on the R&D. It's essential to have those tools, but we also need to bear in mind that we have to do that work with congressmen, with politicians, with ministers. And we need to look at the other perspective, which is the reason why those legislation exist. And that is where it becomes a bit more complicated because it becomes political and economic. And that's where things get into a stopping point because it's difficult to push. We can go with all the arguments, the technical arguments, the public health as a right for health, but we probably need a leverage, an extra leverage that I don't really know now which one it is, or the right moment to find the right person to click that. But I think we're in that situation in which we could move forward much more, but we are blocked because of political. That's
a really important and interesting dimension that doesn't get brought up enough. So thank you for that. 90 minutes was never going to be enough. Let's be clear. But there is just a space. There's literally a few steps away to carry on because we've also got comments online about, well, how about mobilizing political but also financial financing efficiently and sustainably. That's from Vineswari and from the Global Advisors and other comments. We may get kicked out of the room in 2 minutes. So if you want to avoid an embarrassment, I will just use those 2 minutes to hand over, pause the conversation briefly, hand over to Rebecca Graves, Executive Director of Pastor Network, has brought all of this vision together to have a official launch moment.
So I apologize for my voice. I'm not sure that anything I've said while at WHS is actually worth it using my voice for. But the first thing I wanted to do was to thank Marianne, also to thank Elvis, who's right here, for being able to put this vision together, as well as all of the original members of the steering committee of the CAD. What we're trying to do is something different. We're not a PDP, we're not a multilateral. We're just trying to put everyone around the table to talk about dengue in all of its facets, whether that's financing, urbanization, climate, anything that is related to the disease itself. And that disease, like all of them, are political. Epidemics are political. The fall of the Greek Empire was largely linked to an epidemic. And we don't talk about that enough. Maria, I'll mention COVID. And we're seeing the fallout of COVID now, and that's a political fall. And what we're trying to do with the collective action is against dengue is to ensure that that collective aspect, working together, that these connections are made before dengue becomes something which is completely out of control. Globally, Marianne brought this up. Most of the world is either at risk or currently in a situation where they will become at risk. And among those people, 25% of the world's population live in fragile states, or which are either undergoverned or overgoverned sometimes, or not governed at all. And it's those people that we're trying to work for. So you're all welcome to join us. Dengue is multifaceted, and I'm sure you'll find something which fits your personal and organizational interests. And we hope that you'll all join us in working together. So thank you.
Average agree that explains in a bit more detail what the plan is doing and why. And if not, I'll see you down the corridor in a few seconds. Thank you so much to our speakers. Another round of applause. You've really
Yeah.